Hi guys, in the last video we had discussed about sphincters. What do we mean by the term sphincters? What are the various type of sphincters? Now in the last class I had told that sphincter is a kind of a one-way valve. It's not actually a valve. It's a kind of one-way valve. In the starting of that video I had told that it's a kind of a circular muscles. So do not confuse it with a normal valve. It's a kind of a circular muscles which contracts and relax. Let us suppose this is the alimentary canal, this is our mouth, and this would be a kind of a sphincter. If it contracts, it prevents up and down movement of anything. Similarly, if it relaxes, it would allow the flow up and down. So do not confuse it with valves. Yes, its functioning is kind of a functioning of a valve. Here in this diagram, we could see that we had represented the lower esophageal sphincter. Here the lower esophageal sphincter muscles is these muscles. These muscles would contract and relax and would prevent the upward movement of the stomach contents. Now the question in the last video that we are left with is that the same content in the stomach does not cause any harm, but the same content in the esophagus would harm us. Why so? The reason is, if we talk about stomach, the stomach content is highly acidic because of the presence of HCl, hydrochloric acid, in it. And this acid would harm in the layers of esophagus. Yes, esophagus also has a protective layer, protective covering kind of, that we call as mucus. Also it has some bicarbonate ions. But as we progress a little above in the esophagus, this mucus production and bicarbonate ions quantity will reduce. So higher the food material goes up, it would cause more of heartburn, acidity. The mucus production in the stomach is almost 10 times higher as compared to esophagus. To prevent this acidic medium, to prevent the attack of this acidic medium on the layers of the stomach. But this acidic medium would gradually attack the layers of the esophagus. So it is always recommended to avoid overeating and to eat less spicy food. If we talk about some older people in our family, they would be saying that मुझे acidity हो रहा है, kind of. Means they recurrent face acidity problems. The reason behind it would be, we had seen that with age related, the production of mucus gradually decreases. That is why this content, also the functioning of the sphincter would also be hampered at an older age. These all factors would lead to more acidity problem, heartburn problems in older people.